Can atrial fibrillation cause a stroke? Atrial fibrillation refers to a type of irregular heartbeat or arrhythmia that can lead to various heart-related problems, including stroke. Around 2.7 million people in the United States have atrial fibrillation. In atrial fibrillation, the upper heart chambers, called the atria, beat irregularly. This can result in ineffective movement of blood into the ventricles or lower heart chambers. The sluggish movement of blood can lead to the formation of blood clots. A stroke may occur if a clot breaks away, enters the bloodstream and blocks an artery that leads to the brain. According to the American Heart Association, if a person does not receive treatment for atrial fibrillation, their risk of stroke increases by 5 times. As many as 20% of people who have strokes also have atrial fibrillation. Strokes caused by atrial fibrillation are also typically more severe than those with other causes. The most common symptoms of atrial fibrillation is a quivering heartbeat. Other symptoms include irregular or rapid heartbeat, thumping or fluttering feeling in the chest, general fatigue, weakness, anxiety, shortness of breath, sweating, dizziness, confusion or feeling faint, fatigue while exercising, pain or pressure in the chest. Atrial fibrillation and stroke. Atrial fibrillation is a leading cause of stroke and is responsible for 10 to 12% of all ischemic strokes in the United States each year, according to research. Studies have found that atrial fibrillation is associated with a 5 times higher likelihood of ischemic stroke after accounting for other standard risk factors of stroke. Researchers also note that strokes caused by atrial fibrillation related complications are generally more severe than strokes with other causes. Despite the strong link between the two conditions, research indicates that doctors only have a moderate ability to predict the link of stroke in individuals with atrial fibrillation. This may cause difficulty in reducing the risk of stroke in people with atrial fibrillation, as treatments that could potentially prevent stroke, such as anticoagulant therapy with drugs such as warfarin, carry risk of bleeding. Doctors will weigh the risk of stroke against those of bleeding in each individual with atrial fibrillation to determine the safest and most effective treatment for them. A healthcare professional to determine a person with atrial fibrillation's risk of stroke based on their history of congestive heart failure, history of hypertension, age, history of diabetes, history of stroke, history of vascular diseases. Possible limitations. A 2016 study suggests that some researchers may have overestimated the association between atrial fibrillation and stroke. The researchers dispute that atrial fibrillation may increase the risk of stroke 5-fold and state that other risk factors for stroke may have largely contributed to their assessment. They suggest that when other multiple risk factors are present, atrial fibrillation represents a marginally increased risk of stroke, and other factors such as an increase in age represent a higher risk. However, organizations such as the Centers for Disease Control and Prevention and the American Heart Association maintain that atrial fibrillation may significantly increase the risk of stroke. Treatment. Treatments for atrial fibrillation and stroke differ, but both may involve medications and surgery. Atrial fibrillation treatment. Treatment may include blood thinning medications, beta blockers such as which can slow the heart rate, calcium channels blocker, which slow the heart rate, digoxin, which slows the electrical currents between the atria and ventricles, sodium channel blockers and potassium channel blockers, which can help the heart's rhythm, lifestyle changes, surgery including implantation of a pacemaker. Stroke treatment. Stroke treatment may vary depending on the type of stroke a person has and the stage of treatment. It typically includes medication, surgery, and rehabilitation. Medication for ischemic stroke includes tissue plasminogen activator to dissolve a blood clot, blood thinning medication, medication to stop clot formation. Sometimes surgery may include a procedure to open a blocked carotid artery. Medication for hemorrhagic stroke include blood pressure medications. Surgery options include repairing an anteriovenous malformation, a tangle of arteries and veins that may have ruptured in the brain. Another option is coil embolization or aneurysm clipping to prevent blood from leaking from an aneurysm. Rehabilitation for either type of stroke aims to help a person recover skills they lost due to the stroke and help them to gain independence and increase their quality of life. Prevention. Through medication and lifestyle changes, a person can help to prevent atrial fibrillation by rate control, which involves bringing down a high heart rate, rhythm control, which involves restoring the heart's rhythm, preventing blood clots, reducing risk factors of other heart problems, managing risk factors for stroke. A person may reduce some risk factors of stroke by eating a diet and promotes heart health, maintain a moderate weight, exercising regularly, managing cholesterol and blood pressure, giving up smoking, managing stress,